Well, good afternoon, everyone. The reason we're here, make no mistake about it, is Obamacare. That's the law that brought about these reductions. As was suggested a few moments ago, this was a law that was about the uninsured. Everybody agrees it would be better if everyone had insurance, and that was a noble goal. Who were these people? There were roughly 40 million Americans without insurance. About half of them were young and healthy. I thought they were going to live forever and made a not entirely irrational decision not to buy it. The other half had a genuine affordability problem. So what was done about it? Well, unlike Medicare and Social Security, which were passed on a largely bipartisan basis, the administration, because of its huge majorities in the House and Senate, decided to do it their way. And instead of doing things that would have targeted costs, to use a medical metaphor, to use a scalpel to target costs, by doing things like tearing down the silos in 50 states. Right now, health insurance is sold in 50 separate silos. Things like medical malpractice standards, things like allowing small businesses to band together for greater purchasing power, a more targeted scalpel approach. They took a meat axe to the entire American healthcare system, passed a 2,700-page bill with $1 trillion hit on the providers of healthcare over the next 10 years. The $1 trillion hit on the providers, one of which we're talking about here today, was a $700 billion reduction in Medicare reimbursement to hospitals, nursing homes, home health care, hospice, and the like. Raiding Medicare to pay for a program for people who are not elderly and people who are not poor enough to qualify for Medicaid. And in fact, turning Medicare into a piggy bank to finance programs for those who are not elderly. In addition to that, a medical device tax to drive up the cost of things like wheelchairs and stents. In addition to that, a health insurance premium tax to drive up the cost of health insurance. And that's just on the providers of health care. What about the consumers of health care? Lost jobs, higher premiums, higher co-payments, higher deductibles. The Congressional Budget Office, which is an arm of Congress and not controlled by either party, currently run by a former Clinton staffer, said that Obamacare will probably cost the economy 2.5 million jobs. So this 2,700-page monstrosity has a real impact on real people. And we're here today to focus on a portion of these $700 billion in Medicare reimbursement reductions imposed on us by this 2,700-page bill. The single worst piece of legislation has been passed in modern times, in my view. A huge hit on the finest healthcare system in the world. And one of the stars of our fine healthcare system is home healthcare, for all the reasons that have been stated here by the earlier speakers. I mean, what's not to like about home healthcare? You know, what planet are these people on? So you've got a bunch of these geniuses, most of whom went to Ivy League schools, who think they're smarter than all the rest of us, and they're over at CMS, implementing this law in a way that has a dramatic and adverse impact on the people of this country. Now, you're wondering what can be done about it. Well, there's one person in the United States Senate who gets to set the agenda to determine what we will debate. And under the current leader, determine whether we have votes at all, which is rather unusual, actually, but that's the way it's been run lately. If you're a sports fan, I'm currently the defensive coordinator. You can score occasionally on defense, but it's harder. If you're the offensive coordinator, you get to call the plays. You have a better chance to put points on the board. And for today's purposes, you get to schedule votes on legislation that matter. So changing the majority leader of the Senate can have a direct impact on the issue we gathered here today to talk about. No longer will it be swept under the rug. No longer will we avoid voting on it. Make me the majority leader of the Senate. It'll be on the schedule. We'll be voting on it.